How to read x-rays out loud. If you are a PA new to orthopedics or a medical student on orthopedics, you may be asked to read x-rays during fracture conference. This can be a scary experience, but also a great opportunity to stand out and be a star. To help you do this, I put together these talks called Crush X-ray Rounds. This is part 2, how to read fractures. If you haven't seen part 1 already, go back and look at that. That talks about the first sentence during your presentation. So let's move on to part 2, reading fractures. So here's part 2 of Crush X-ray Rounds. In the last video, we talked about the first sentence out of your mouth will be which view, is it a kid or an adult, and what body part. Now, when reading X-rays out loud, there are levels to this, and I labeled them 1 through 7. In this next talk, we're going to talk about level 2 and 3. So level 2, which bone and where on the bone. Now, the simplest way to describe where it's broken is to divide the bone into thirds. So we call this the proximal third, the middle third, and the distal third. Oftentimes, we'll just call this proximal and distal. So, for example, if you'd read this X-ray, you'd say this is an AP of a skeletally immature patient showing bilateral femurs. If there's a fracture here in the proximal third, you would just call it a proximal femur fracture. If there were a fracture down here, you would call it a distal femur fracture. And if there was a fracture here, you would call it a middle third femur fracture. You could also call it a mid-shaft femur fracture. If the fracture is so far proximal or so far distal, it goes into the joint, we actually specify it with this special term called intra-articular, because anytime a fracture goes into the joint, it deserves special attention. And if you can point that out in X-ray rounds, you'll be seen as a star. So let's do an example. Level 1 is describing what you're looking at. So this is an AP of a skeletally immature tib fib. And how you look for a fracture is, number 1, you're going to run your eyes along the cortices of the bone here. Now, there's a disruption here, but that is the physis or the growth plate. You're going to run your eyes here. And on this particular bone, the fibula, there is no disruptions. Let's do the same on the tibia. So here's the growth plate of the physis. Here's the other physis of the other growth plate. And we're going to run our eyes along this cortex, and lo and behold, there's a little step off here. The other thing you're going to look at is this cancellous part of the bone, this sort of gray area, and the texture of that. If there's a disruption, that's another signifier of a fracture. So here is our fracture. Number 1, we say, what bone is it? It's a tibia fracture. And the next level is where on the bone. Well, we would call this a middle third tibia fracture. So in total, if this shows up on fracture conference and they call on you, you will say, this is an AP of a skeletally immature tib fib showing a middle third tibia fracture. And that is a great start to your presentation. Middle third. Let's do another one. So this is an AP of a skeletally immature tib fib showing a fracture of, and again, we're going to run our eyes along the cortices, and there's a disruption here. Run your eyes along the medullary canal, and there's a disruption here. So here's our fracture. Again, this is a growth plate. So is that, incidentally. Here's our growth plates. So it's a fracture of the tibia. And what part of the tibia? The proximal tibia. So we would just call this a proximal tibia fracture. Next example. Imagine you were in fracture conference. The first sentence is, this is an AP and lateral of a skeletally mature tib fib. Let's run our eyes along the medullary canal, and there's a disruption. Run our eyes along the cortices. Here's a disruption. Always want to check the other bones as well, and there's no disruptions on these bones. So we're going to describe this fracture. This is a fracture of the tibia. And where is it? Is it in the proximal part, the middle part, or the distal part? Well, this is sort of the junction, but I would call this a distal tibia fracture. Next example. If you're in fracture rounds, you're going to say this is an AP and lateral of a skeletally mature ankle. It's not the whole tib fib, it's the joint, so we call this an ankle. So running our eyes along the cortices of the fibula, definite step off here, and a step off here. So we have a distal fibula fracture. And running our eyes along the cortices of the tibia, definitely disruptions here, disruptions here, disruptions here, and disruptions along the medullary part of the fracture. You want to be systematic about it so when there are more subtle findings, you'll be able to pick them up. Now, like we said, this is a distal tibia fracture, but there's a special case because the fracture goes into the joint. So if you present this as this is an AP of a skeletally mature ankle, showing a distal fibula fracture and a distal tibia fracture that is intra-articular. Well, that's a wonderful presentation, especially if you are new to orthopedics. Distal plus intra-articular. And it's one other example. Here's an AP and lateral of a skeletally mature knee. Let's do our scanning of the cortices, the medullary canal. And following along here, there's a break here and a step off here. And along the medullary canal, you can see the shadow. The darker area is a fracture. So we'd call this a fracture of the tibia, and it is the proximal part. So we call this a proximal tibia fracture that extends intra-articular. So as a summary, that's the end of level 2. If you can identify what bone is broken, and then follow that up with, is it the proximal, middle, or distal part of that bone? Extra bonus if you notice if it's intra-articular. Well, you've done a great job. You will get a medal. This is actually a bronze medal. So you get a bronze medal. You've checked off level 1, checked off level 2. Now we're looking at level 3. So if you complete level 3, describing fractures around the physis, you will get a silver medal. So let's go back to this original image. This is the same one we looked at before, and I want you to pay attention to the growth plate. So this is a skeletally immature patient. You see a physis here, or growth plate, physis, same thing. Another physis here. There's actually another one that's pretty much closed, another physis here, and the distal physis right along here. Historically, orthopedics was actually a pediatric field. We were just straightening kids' bones. So a lot of the nomenclature is a remnant of treating children. So we still label bones in relation to the physes, even when the growth plates are closed. So the growth plate themselves are called the physis. The ends of the bones, proximal and distal to the physis, are called the epiphysis or the epiphysis. The spanning area of bone across them is called the diaphysis or the diaphysis, and the transition zone between is called the metaphysis or metaphysis. Now, when you fracture in either the metaphysis or the diaphysis, if you label that as such out loud, it gives the viewer a better picture in their minds of what the fracture looks like, even if they're not even looking at the picture. So let's go back to the same x-rays we looked at before. So here is that AP of a skeletally immature tib fib. We know this is the fracture, and we know it's the tibia. Now, before we called this a middle third tibia fracture, but now that we know those more advanced terms, we can call this a mid-diaphyseal fracture or a fracture of the tibial diaphysis. Next example, we have an AP of a skeletally immature tib fib showing a fracture of the tibia. And it's a proximal tibia fracture, and it is through is it the diaphysis or the epiphysis? No, it's through the metaphysis. So if we say this is a fracture of the proximal tibial metaphysis, well, you get a silver medal. Proximal tibial metaphysis. Same x-ray as before. Here's an AP and lateral of a skeletally mature ankle showing a fracture. Let's just focus on the tibia for now. The fracture of the distal tibia. It's intra-articular, and yes, it involves the distal tibial metaphysis. So if you can call this a distal tibial metaphysis fracture with intra-articular extension or any combination of those words, will be doing an excellent job. And finally here we have an AP and lateral of a skeletally mature knee showing a fracture of the proximal tibial metaphysis that is intra-articular. proximal tibial metaphysis, and interarticular. So for level 2 and 3, very similar ideas, but if you stack these two ways of labeling fractures, you'll really stand out, especially if you're a new student, new on a rotation. So those are the first baby steps to describing fractures out loud. In the next video, we're going to talk about the head and the neck of certain fractures and describing displacement.